Hello everyone, I'm Dr. Shovana, consultant in the Department of Internal Medicine, Jaypee Hospital, Noida. Today we are going to talk about the recent cough and fever happening and the surge in the cases. See, first of all, we want to know what is this? This is a seasonal flu, one. And second, because there have been some clustering of COVID cases. So we have to actually differentiate, is this a seasonal flu or a COVID? Now, let's talk about this influenza first. This influenza has been happening before as well. It's a seasonal influenza. Basically, there are two types of viruses. One is influenza A, which has two subtypes. Subtype A, which is H1N1, and subtype A, which is called as the H3N2. The other one being B, influenza B, C, and D. So, recent surge which has been found out, we do testing and we have found out it has been H3N2. Now, there is a point we have to know whether there is a need to panic or not. See, this H3N2 is a variant of this, as I told you, the A viruses. Now, what happens? It has been there before as well. So, our body has a bit of immunity against all this. But because there was no recent infection, as a result, the immunity has gone down, and we can see a latest, the outbreak or the surge in the cases. Now let's talk about the modes of transmission of this virus. See, the modes of transmission are the same. The coughing, sneezing, as a result of what the virus is carried into the droplets, and if that is inhaled by other person, that can cause infection in that person as well. Then there is the formite. That is, if we touch the tabletops, if an infected person touch the tabletops, the door handles or other items, the virus can get transmitted to the other person. So we can see, yes, there's a very easy mode of transmission. So the basic symptoms if we talk about would be the high grade fever, the abrupt rise in fever like 103, 104, body aches, headaches, then muscle spasms, pain, sore throat, running nose, a malaise, a feeling of being unwell, then this cough. Cough sometimes may persist 2 to 3 weeks. Usually, in this period, we have seen people coughing a lot, and not in a 1 week to 10 days, which is the usual scenario in these viral illnesses. It still prolongs, and when we just examine those, we see yes, there's a lot of bronchospasm, and they require certain bronchodilators. So that's where the importance of a doctor happens. You have to see the doctor. What are the diagnostic tests? See, usually since this time of the, if we see the tropical countries, usually this time of the year we have the seasonal flu. And initially we did not actually investigate or do the testing for the flu. But because we have seen, we have gone through this COVID for last 2 to 2.5 years. So here and there, so now we are seeing a little clustering of the cases of COVID also because COVID has been very, very lethal for the population. So there is a sense that we do the testing for differentiating if it is COVID or an influenza. So if COVID negative, we have treatment for influenza. We have antiviral drugs which can be given. And if it is COVID, then again we have to seek whether what strain. For now, the COVID is important because we need to know what strain, the genome sequencing of the COVID is important. Like what we are finding these clusters, this is the XBB 1.16. So is that the variant of concern? That means can it cause a very severe disease, or it is just that because it is easily transmissible it can spread and cause increase in the positivity rate. So point here is to do the genome sequencing and know whether this particular variant which has been identified is a variant of concern, so that we can be accordingly ready for the severe care of the patient. Then once we have differentiated that yes, it is not COVID and it is plain influenza, usually it is a 7 to 10 day illness. And taking the symptomatic treatment, patient gets well because it's a self-limiting disease. However, we have to understand the high risk group. Who are the high risk group? We have to know, yes, the pregnant females in any stage of pregnancy, any person with comorbid conditions, any person, any child less than 5 years of age, any person with respiratory illnesses like COPD, like bronchial asthma, and immunocompromised, or those patients who are on immunosuppressive drugs. These patients are defined as a high risk population. In them, yes, we have antivirals like oseltamivir, which has to be initiated within 48 hours. And the usual course is a very short duration of 5 days. But yes, it depends upon the doctor's discretion. He or she may prolong the treatment according to the requirement of the patient. In this influenza, in especially the high risk population, can cause severe disease in form of influenza pneumonia or severe acute respiratory illness. These are the conditions where the lung parenchyma is involved, as a result of which there is dip in the saturation, which is an alarming situation. So, in the general population, no need to worry, but yes, we should identify the high risk population where which have to get tested. Yes, prevention is there. One, yes, if somebody is infected, we can maintain those isolation criteria like hand hygiene, masking. Yes, third would be the physical distancing, should not go into the crowded places. Apart from that, we have an annual vaccine for the influenza as well. We have a quadrivalent vaccine, which is against both the strains of influenza A and B as well. So that can be annually taken, especially in the high risk population, so that these complications can be avoided. Complications can be prevented. If you talk about our Jaypee Hospital, I see a lot of patients in my OPDs around a lot of patients with this H1 H3N2 flu. We do the flu panel testing here, and we get this H3N2 flu has been there for last say 1 month. Most of the patients are very symptomatic for high grade fever, which is they require paracetamol round the clock, maybe some more analgesics to keep off their pain, the cough, the sore throat, other decongestants in form of treatment, and of course the antiviral treatment, which has to be started and which has to be given for a small course of 5 days. And patient gets well. Maybe they require some supplements later on, but yes, they are most of them are treated on the OPD basis. However, there are patients who come with acute bronchitis like picture, in which they have a lot of wheezing, they have a lot of coughing at home, and sometimes there they have the past illness of say bronchial asthma or COPD, and that causes their dip in saturation, which needs admissions. Here at hospital, we have the isolation facility for these flu patients, which come with acute exacerbation of their primary lung conditions with concurrent this flu. But yes, we do have facilities at our hospital in form of the ICU, in form of the wards, wherein we can take care of these pneumonia patients. So one thing I want to tell the audience, I want to tell the viewers, yes, you don't need to panic, but yes, if you fall into that high risk age group, please get to the hospital, please go to the doctor, get yourself tested, and get yourself treated. Thank you.